Have you ever woken up with a scratchy throat, finding it painful to swallow? Perhaps you had a fever and felt unusually tired. You might have experienced strep throat, a common bacterial infection. Strep throat affects millions of people each year, particularly children and teenagers. It's important to understand this condition because, if left untreated, it can lead to complications. This essay will explore the ins and outs of strep throat, providing you with the knowledge to stay healthy. Throughout this essay, we'll delve into what causes strep throat, how it spreads, and the telltale signs to look out for. We'll also discuss ways to prevent contracting this infection and effective treatment options to alleviate symptoms. Being informed about strep throat empowers you to take charge of your health and seek timely medical attention when needed. Strep throat specifically affects the throat and tonsils, those oval-shaped pads at the back of your throat. It's an infectious disease, which means it can spread from person to person. While viruses cause most sore throats, strep throat results from a specific bacterium. This distinction is crucial because viral and bacterial infections require different treatments. Understanding the difference between a common sore throat and strep throat is important for seeking appropriate medical care. While a common sore throat might be a nuisance, strep throat requires specific antibiotics to clear the infection. In the next section, we'll take a closer look at the bacterium responsible for this common ailment. The culprit behind strep throat is a bacterium called Group A Streptococcus, or gas. This bacterium thrives in the nose and throat, and it's highly contagious. When an infected person coughs or sneezes, tiny droplets containing the bacteria become airborne. These droplets can infect others who inhale them or touch surfaces contaminated with these droplets and then touch their mouth or nose. It's important to note that not everyone exposed to gas will develop strep throat. A healthy immune system can often fight off the infection. However, certain factors, such as close contact with infected individuals or a weakened immune system, can increase the risk of contracting strep throat. In the next part of this essay, we'll explore how strep throat spreads and discuss ways to minimize your risk of infection. Strep throat spreads through close contact with infected individuals. When someone with strep throat coughs or sneezes, they release tiny droplets containing the bacteria into the air. These droplets can travel up to 6 feet, potentially infecting anyone within that radius. Inhaling these infected droplets is a primary mode of transmission. Another way strep throat spreads is through contact with contaminated surfaces. Imagine an infected person touches their nose or mouth, and then touches a doorknob, toy, or shared utensil. The bacteria can linger on these surfaces, waiting to be picked up by the next person who touches them. If you then touch your mouth, nose, or eyes, you can introduce the bacteria into your system. Section 2. Close contact, the breeding ground. Certain environments facilitate the spread of strep throat due to the nature of close contact. Schools, daycare centers, and other crowded settings provide ample opportunities for the bacteria to jump from one individual to another. Children in particular are susceptible due to their close interactions and developing immune systems. Households are another breeding ground for strep throat. Living in close quarters with an infected family member increases the likelihood of transmission. Shared spaces, common items, and close physical contact within a household provide numerous avenues for the bacteria to spread. Section 3. Vulnerable populations. While anyone can contract strep throat, certain groups are more vulnerable to infection or experience more severe symptoms. Young children, particularly those under the age of 5, have a higher risk of contracting strep throat. Their immune systems are still developing, making them more susceptible to infections. Individuals with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are also more susceptible to strep throat. Their compromised immune systems may struggle to fight off the bacteria, leading to more severe infections and complications. Section 1. Telltale signs, recognizing strep throat. Strep throat announces itself with a set of characteristic symptoms. Recognizing these signs early is crucial for seeking timely treatment and preventing complications. One of the most common and noticeable symptoms is a sore throat that comes on suddenly and can be quite painful. Unlike a sore throat caused by a virus, strep throat pain is often more severe and can make swallowing difficult. Another telltale sign of strep throat is inflamed tonsils. The tonsils, located at the back of the throat, may appear red and swollen. In some cases, white patches or streaks of pus may be visible on the tonsils. These white patches are a strong indication of a bacterial infection, such as strep throat. Section 2. Beyond the sore throat, other common symptoms. While a sore throat and inflamed tonsils are hallmark symptoms of strep throat, other common signs accompany the infection. Fever is frequently present, often reaching 101 degrees Fahrenheit or 38.3 degrees Celsius or higher. The fever may be accompanied by chills, making the person feel cold even in a warm room. Headache is another common symptom of strep throat. The pain may range from mild to severe and can be throbbing or constant. Along with a headache, individuals with strep throat often experience body aches and pains, making them feel generally unwell. Fatigue and weakness are also common, making it difficult to participate in everyday activities. Section 3. When to worry, severe symptoms. While most cases of strep throat resolve with appropriate treatment, some individuals may develop more severe symptoms that warrant immediate medical attention. One such symptom is difficulty breathing or noisy breathing. If you or your child experience difficulty breathing, seek medical attention immediately. Another concerning symptom is a stiff neck or difficulty turning the head. This symptom may indicate the infection has spread beyond the throat, potentially affecting the lymph nodes or other areas of the neck. Swollen lymph nodes in the neck are another sign to watch for. The lymph nodes, small, bean-shaped glands, may become enlarged and tender to the touch. Section 1. Shielding yourself. Preventive measures. Strep throat is highly contagious, but you can take proactive steps to protect yourself and others from this bacterial infection. Prevention hinges on understanding how the bacteria spread and adopting hygiene practices that minimize transmission risk. By incorporating these measures into your daily routine, you can significantly reduce the likelihood of contracting or spreading strep throat. One of the most effective ways to prevent strep throat is by practicing good hand hygiene. This means washing your hands frequently throughout the day, especially after using the restroom, before eating, and after coughing or sneezing. Use soap and warm water and lather your hands for at least 20 seconds, ensuring you clean between your fingers, under your nails, and the backs of your hands. In addition to frequent hand washing, several other hygiene habits can help prevent the spread of strep throat. Cover your mouth and nose when you cough or sneeze. Use a tissue or the inside of your elbow to contain the droplets and, prevent them from becoming airborne. Avoid close contact with individuals who are sick, especially if they have symptoms of strep throat. Don't share personal items such as utensils, cups, toothbrushes, or towels with others, as this can facilitate the transmission of bacteria. Keep frequently touched surfaces clean and disinfected, especially in shared spaces like kitchens, bathrooms, and workplaces. Use a disinfectant spray or wipes to kill any bacteria that may be lurking on these surfaces. While hygiene practices are paramount in preventing strep throat, additional safeguards can further reduce your risk of infection. If you know you've been exposed to someone with strep throat, consider wearing a mask to minimize the risk of inhaling infected droplets. Stay home from work or school if you're feeling unwell, especially if you have a sore throat, fever, or other symptoms of strep throat. Maintaining a healthy lifestyle can also strengthen your immune system and make you less susceptible to infections like strep throat. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, getting enough sleep, exercising regularly, and managing stress. By taking care of your overall health, you empower your body to fight off infections more effectively. When it comes to strep throat, swift and appropriate treatment is essential to combat the infection and prevent potential complications. Unlike viral sore throats, which usually resolve on their own, strep throat requires antibiotics to eliminate the bacteria responsible for the infection. Antibiotics are medications that target and kill bacteria, effectively stopping the infection in its tracks. your doctor will prescribe a course of antibiotics, typically penicillin or amoxicillin, to treat strep throat. It's crucial to take the full course of antibiotics as prescribed, even if you start feeling better before completing the medication. Failing to complete the full course can lead to antibiotic resistance, making it more difficult to treat future infections. While antibiotics work to eliminate the bacteria causing strep throat, you can implement several home remedies to alleviate the uncomfortable symptoms and promote comfort during the recovery period. Gargling with warm salt water can provide soothing relief from a sore throat. Mix a teaspoon of salt in a glass of warm water and gargle for 30 seconds. Then spit out the water and repeat as needed. Staying hydrated is essential when you have strep throat. The fever and sore throat can lead to dehydration, so drink plenty of fluids such as water, broth, or herbal teas. Warm liquids in particular can help soothe a sore throat and loosen mucus. Avoid sugary drinks, as these can irritate the throat and worsen discomfort. While most cases of strep throat respond well to antibiotics and home care, certain situations warrant prompt medical attention. If your symptoms don't improve or worsen after 2 days of starting antibiotics, consult your doctor. This may indicate the need for a different antibiotic or further evaluation. If you experience difficulty breathing, severe throat pain that makes swallowing impossible, a stiff neck, or a high fever that doesn't come down with medication, seek immediate medical attention. These symptoms could indicate a more serious complication or the spread of infection, requiring prompt medical intervention. Strep throat, a common bacterial infection, can cause significant discomfort and lead to complications if left untreated. We've journeyed through the intricacies of this ailment, understanding its causes, transmission, symptoms, preventive measures, and treatment options. By recognizing the telltale signs of strep throat, such as a severe sore throat, inflamed tonsils, fever, and swollen lymph nodes, you can take proactive steps to seek timely medical attention. Remember, strep throat is highly contagious, spreading through close contact with infected individuals or contaminated surfaces. Practicing good hygiene, such as frequent hand washing covering coughs and sneezes, and avoiding close contact with sick individuals, is crucial in breaking the chain of transmission. If you suspect you or your child has strep throat, it's essential to consult a healthcare professional for an accurate diagnosis and appropriate treatment. A simple throat swab test can quickly determine if the infection is caused by the strep bacteria. Based on the diagnosis, your doctor will prescribe a course of antibiotics to eliminate the bacteria and prevent complications. While waiting for medical consultation, you can alleviate discomfort with home remedies such as gargling with warm salt water, staying hydrated, and getting plenty of rest. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help reduce fever and manage pain. Avoid giving aspirin to children, as it has been linked to a rare but serious condition called Reyes syndrome. Knowledge is your best defense against strep throat. By understanding the nature of this infection, its transmission routes, and effective preventive measures, you can significantly reduce your risk of contracting or spreading this contagious ailment. Remember that prevention is always better than cure, and adopting healthy hygiene practices can go a long way in keeping strep throat at bay. If you do contract strep throat, don't panic. With prompt medical attention, appropriate antibiotics, and supportive home care, you can overcome this infection and return to your healthy self. By staying informed and proactive, you can navigate the challenges of strep throat effectively and safeguard your well-being and that of your loved ones.